routine outcome measures are an underlying principle of this program. And the idea of the routine outcome measures is that basically the work that we do with our clients, how do we know that it's working unless we measure it? So using outcome measures. So it's to promote collaborative approach. So we are working actively with our clients with regards to the treatment plan, the goals around therapy. So they help shape the goals and they take part in the therapy. It's not something that's done to them, it's done with them. And what we do is over time, we monitor the goal, we monitor the outcomes. So we may have used like a pre and post measure. We may have used a measure at the beginning of treatment and at the end of treatment, and we're looking at what difference the treatment made. Some interventions also will use measures on a weekly basis. So for argument's sake, I do interpersonal therapy, and each week when I meet with the clients, we use the PHQ-9. And then I have a chart where I rate the scores on a weekly basis. And the idea being that if over a period of time you're not seeing any difference, you'd have to ask the question as to whether or not it's appropriate to continue with that intervention if no difference is being brought about. So it guides the therapist with regards to the treatment that they're offering, and that you would take what you've learned with the client to your supervision. So the question is, are you routinely using outcome measures in your clinical practice? Right, so I'm just going to try something with you. I've got to stop this screen and share another screen. So if you just bear with me, please. Okay. I believe you can all see my screen. Yes. Right. So if you could kindly go to the website mentioned above. I'm hoping that you might have a mobile phone handy, or you can use the computer that you're viewing. If you go to this website called menti.com, and then it will ask you to provide that code 798084. And once you've provided that code, it will enable you to answer these questions. So from the left, you've got strongly disagree, and on the right-hand side, you've got strongly agree. So I'm wondering whether or not you're using routine measures in your clinical practice, if you think that they are a valuable part of your clinical practice, if you discuss them routinely in your supervision, or if you do or you don't, whether or not you think they would be valuable to share within supervision. And I believe as you are inputting the data, it should be coming live to us.